Hi, I'm Dr. Marcy Willard. I am the CEO of Clear Child Psychology. I also have my doctorate in psychology. I'm a licensed psychologist, a licensed school psychologist, and I spent many years doing diagnostic evaluations in hospitals and clinics and working in schools as well. And the good news is the kids are still wonderful. The bad news is the kids are not getting the kinds of help and treatment that they need. Fortunately, many of the great providers that I know out there in the community doing diagnosis are literally going out of business with a 2-year wait list. Why would that be? What's happening is the diagnosis process takes a really long time, and the reimbursement rates are not keeping up with that. So good clinicians are literally spending twice the amount of time on an evaluation that they'll ever get paid for. And they still have the good heart to do it, and unfortunately, it's not working. We decided that we wanted to help that. We wanted to make it better out there. And the first thing that we did was we had written up this textbook about how to do a diagnosis. And we kind of compiled all of the research out there about what are the main areas that need to be tested for any kid that might have a concern. And unfortunately, not everybody's going to want to read this textbook. It's kind of big. So we thought we could break it down. Let's make it simple. Let's make it clear. And so we developed a diagnostic framework. I thought, well, if we are going to have all of this really readily digestible information, originally I thought I could put it on a website, and that was helpful. However, I wanted to find a way to have that help with diagnosis, because it's one thing to be educated, it's another thing to get the diagnosis that's going to lead to the treatment to help the kid. And so what we did was reach out to the community, to these wonderful providers that we know. So there are great speech-language pathologists out there, marriage and family therapists, licensed professional counselors, pediatricians, and MDs who do want to help this process. And they may or may not have the experience or the potential to make a diagnosis, but they do know a ton about these kids. And I thought, couldn't we work together, me as a diagnostic clinician and you as a therapist or treating provider or doctor? What if we were to put all of our information into one medium, some kind of a digital format where we could communicate our concerns? And on top of that, each of the symptoms that we've identified here in this framework leads directly to specific interventions. And as you know, it's not rocket science. If I can teach one kid about how do I work on my empathy, then there is a system that we can follow. There's a way to translate that so that parents know what to work on, clinicians know what to work on with the child, and the kid eventually gets better.
So as I mentioned, collaboration. One of the coolest things about CADE is that you can take input from a number of different individuals who work with or know a child and get a picture of what they're seeing as concerns in a snapshot before you even meet with the family. So when using CADE in our clinical practice, we send a link to have this form completed by a caregiver and a referral source, sometimes two. Sometimes we get a psychiatrist and a teacher, or a therapist and a speech pathologist. And we'll gather that information prior to even meeting the family. I can take this caregiver profile here, click a simple button, and see what the caregiver thinks about Matthew, this individual's abilities in communicating, socializing, daily living, moving and sensing, and so on. We have 11 domains here on the left side because those domains are most crucial to comprehensive neuropsychological. When we do an assessment, we want to make sure we touch on all of these areas so that we can make recommendations that are appropriate for a family, even if all of these areas are not in themselves diagnostic symptoms for autism. I'm going to come back to the input section here and show you a little bit more about our items.
Let's look at the socializing domain for a moment. In each of these domains, this one particular, are going to have 15 items. This is one of our lengthier domains. Let's take shared enjoyment. That's the area for assessment, and the question you're answering is, enjoys playing or being alone rather than engaging with the people in the room. We recommend that every time you read a question, you then click on the question mark to understand how we would like you to rate these items. For shared enjoyment, you should put no concern if this individual shows enjoyment when playing, talking, or interacting with others by laughing, smiling, making eye contact, and staying engaged with another person throughout the interaction. If the child or individual enjoys playing with others or talking with others, but only when in charge or discussing a topic of interest, you would rate moderate concern. If you still have some questions and would like to know more after reading the question mark item, you can come to Tell Me More. This is an image resource item. Here you'll see the image for shared enjoyment, a brief description about what's going on in the picture. These two people are sharing enjoyment as they swing and look at the clouds. They're laughing, looking at each other, perhaps sharing toys or activities, and they're having fun with one another. You'll then get a clinical description that gives you a little bit more information about what shared enjoyment is. After you've reviewed these materials, you're going to make a selection based on whether for your child or the individual you're rating, you think there's no concern in this area, a mild concern, moderate, significant concern, or you just don't know. Any of these options is appropriate for you to check.
Let's look at one more. Let's have a look at formal language. So here we're wondering if this child sounds like a professor. So maybe using big words out of context or being far too formal for a more casual conversation. Maybe the individual offers excessive detail, and so that's significantly concerning. Whereas age-appropriate words, typical speech indicates that we don't have concerns about formal language. Here for formal language, you'll see we also have an image resource that provides a picture depicting the area of assessment, as well as those descriptions that we looked at with shared enjoyment. This item also has an article resource, so you can link to an article that our clinicians have written that talks about formal language, describing what that is, and giving some ideas on how you can work with a child or teenager who has a challenge in that area. So part of demystifying autism is providing resources and understanding of these 80 symptoms that we think are crucial when you're making a diagnosis of an autism spectrum disorder. Cool, because when you click the analysis tab, you can very quickly analyze all of your responses. So the clinician has met with a child, has answered the questions, and then can take a look at the areas that are most concerning. When we do a feedback with a parent, we screen share and show these areas and talk about the areas that were most challenging. So our feedback sessions are very symptom-based. They're quicker, they're more effective, and we think families come away with a better understanding of what's going on for their child. You can see we have simple descriptions of areas of typical development and areas of concern. And we also have clear recommendations. So we talked a bit about shared enjoyment, and we can give ideas here in this recommendation for how a family or at school shared enjoyment could be approached as an area to intervene. So the areas that are concerning for this child will all be listed and will all have detailed, friendly recommendations. about doing the CADE assessment is getting an autism score based on your input that has a score confidence of 99.89%. Here, this AST score of 40 is solidly in range of those diagnosed with autism, and you can see that, and that's something we can provide for the families, and for other clinicians working with Matthew. So here you'll see just a visual overview of the 11 areas. Obviously, socializing is the most concerning area for Matthew. And again, those flagged recommendations that are most related to autism spectrum disorder. From this, you can also generate a report, putting information in and generating a report about Matthew's strengths and weaknesses that provides parents all kinds of resources. And this can be completed by a clinician in 2 hours or less.
As a family unit, we were all struggling to figure out what to do. Someone introduced us to Clear Child Psychology, and that was the start of a really really helpful path. I can't say enough about the how great we felt coming out of that evaluation. We were. There was a weight lifted, like, okay, yes, we were right. There was something wrong there that, that wasn't at the norm for a 6-year-old, and we've got a plan. We've seen his relationship with his siblings get a ton better. We've seen his compliance when it comes to our requests get a lot better. Our stress levels are certainly a ton better as parents. Than they are problem solvers, and that they truly care about your kiddos.
So the not knowing as a parent of a child with special needs, that is the painful part. So we had been stuck in this cycle, and just getting out of that cycle was incredible. That moment changed the course of my family's life. Feeling like you matter and your experience in the process matters. It was just natural. It wasn't anything that was forced or felt contrived. I felt like my daughter was being able to be seen for who she is. I can't express the difference that having Clear Child Psychology and the CADE program has made in our family's life.
It makes it easier for the pediatricians in the sense of giving them expertise that they can use this instrument almost alongside a psychologist. It's so detailed in going through all of the different symptoms and signs and characteristics of an individual with autism, because we know that spectrum is so broad and these individuals all look somewhat similar but different in their own ways. So it gives the pediatrician the support they need to feel comfortable, and also a lot of explanation and a lot of detail in giving feedback, even to say this is the profile of your child, not just any child with autism. The CADE instrument displays that autistic profile. So it's not just you're meeting all of these criteria, but this is where you're having strengths, this is where you're having challenges. And I think it does make it very individualized. It gives the families hope that just felt like their tool is at the cutting edge of what we need